Yeah. All right, so we continue from where we stopped. Sorry for the technical hitches that happened. We were explaining personality and we explained that it is an enduring pattern of life and it can be shaped by the environment. It can also be formed on genetics, based on genetics, and can be shaped by environment. And we were looking at the key characteristics. We mentioned that it is consistent, it is individualistic, and it can also be dynamic. So that was where we stopped. So now let's look at what personality disorder is. Now that we've laid the foundation of what personality is, what then is personality disorder? So personality disorder is a type of mental health condition. Let's take note of it. When we were talking about personality, we say it's an enduring pattern of life of an individual. That is who the person is. It is not a mental health condition. But when a disorder now sets in, then we talk of personality disorder. So personality disorder is a type of mental health condition that is characterized by rigid and unhealthy patterns of thinking, functioning, and behaving that significantly impair an individual's ability to relate to others and navigate daily life. So all that we've mentioned for personality, now when all these become disordered, when they become problematic, there we are talking about personality disorder. When we're talking about personality, we said that it is flexible, meaning it is that it can change based on.
Brother Letiavo. Madam Anamwa.
Please let's mute, okay? So when it comes to the disorder, it is rigid, meaning it's difficult to change. As it is formed, it is kind of static and unhealthy. So this time around, the way of thinking of the individual becomes unhealthy. How they behave, how they feel, how they relate with people, how they navigate life issues, all become problematic. So personality disorder can be is a mental health condition that is characterized by rigid and unhealthy pattern of thinking, functioning, and behaving that significantly impair an individual's ability to relate to others and navigate daily life. So these patterns deviate markedly from cultural expectations and can lead to distress and dysfunction. So how society expects an individual to behave in that context, when a disorder comes up in a person's personality, the individuals tend to deviate, go out of what is termed normal. This time around, the person goes out of what is termed normal, and people then start to question, why is this person behaving this way? Or what is happening? Because that is not who we know the person to be. So we know the person with his personality. But this time around, when the person starts deviating, then there's a question mark over there. And that is where personality disorder comes in. So just like we did for the personality, let's look at the key features of the disorder. One, inflexibility. Compared to when we're dealing with personality, we mentioned that Personality is flexible. However, when it comes to the disorder, it is inflexible. Individuals with personality disorders exhibit persistent pattern of behavior that are inflexible and maladaptive. So this time around, the way of life of the person which is deviating becomes kind of static. It is not like personality which can adapt based on environmental changes or life events or whatever. This one, the person is just flat on it. That's the disorder. It is persistent and it is inflexible. And it's problematic, that is maladaptive, because what the person is doing is actually not what we expect of the person. So it cannot really change unless you manage it or you treat it. If you don't treat it, it can't change. So it continues to disturb the individual. Then functional impairment. These behaviors typically result in significant problems in social, occupational, or other areas of functioning. When a person's personality becomes disordered, it affects almost every aspect of their life. So they are not able to relate to people effectively. Their thinking patterns become disordered. How they feel become maladaptive, and their behaviors become very questionable. So when it happens like this, these persons, even at their workplaces, these things start affecting them, because how they think, how they behave, how they feel, how they relate to people are all now basing on the disorder. Meanwhile, the individual, him or herself, doesn't even know that their personality type is disordered. They feel that is how it's supposed to be, but it's a problem. So in their social settings too, it brings a lot of problems there. In their relationships, marriages, even school, and other aspects of their life all become, they find it difficult navigating situations over here. And it brings a lot of distress. Personality disorders can cause significant distress for the individual and those around them. So not just for the individual, but people around him or her. So people in his house, the spouse and children, other family members, people in their neighborhood, almost everybody, classmates, work colleagues, everybody, if somebody has this personality disorder, it reflects all through this, or it permeates through all these places, and it can affect the people around them as well as the individual himself. So somebody experiencing personality disorder, it's necessary we pay attention to it and help the person resolve it, because it's not only the person that will suffer, but others around them too will also experience some of the stress. So it can cause significant distress for the individual and those around them. So the differences between personality and then personality disorder. So we say personality refers to the unique and enduring trait that shapes how a person thinks, feels, and behaves. And they are typically flexible and adaptive. And this flexibility and adaptability is based on the prevailing environmental issues, their experiences, socialization, education, and all what upbringing and all those stuffs. But in contrast, personality disorder is a mental health condition where these traits become rigid, they become inflexible, and cause significant distress or impairment in daily life, making it difficult to function and maintain healthy relationships. So this is the simple difference we can bring in here. Now, in the DSM-5, personality disorders have been grouped into 3 clusters or 3 groups based on some characteristics that runs through some of them. They are groups or they are yes, grouped like that. So you have three groups or three clusters. You have the cluster A, cluster B, and then cluster C. So with the cluster A, we have three conditions under them or under it. In cluster B, we have 4, and in cluster C, we have 3. So in all, based on the DSM-5 criteria, we have 10 personality disorders, each of them with their own unique characteristics, but some trait runs through a particular cluster. So if you take the cluster A, for instance, they are saying that the things that run through is their behaviors are kind of odd, eccentric. So you're talking about eccentric, that's someone or something that is unconventional, something that is not usual. Something that is not usual of the person, like you see, odd, eccentric. So these personality disorders that are in the cluster A, their behaviors are kind of odd. And if you think about it, like it doesn't really make sense like that. And you don't know why they are doing that. And mostly these things, as you mentioned, they deviate from the norm that we know for the person. So under the cluster A, so today as I mentioned, we are going to do this in 3 weeks. So today I'm going to focus on the cluster A. Next week, we'll focus on the cluster B. And then the last week, we'll focus on cluster C. So under cluster A, we have 3, which I want to go through them this evening. The first one is paranoid personality disorder. The second one is schizoid personality disorder. And then the third one in the cluster A is schizotypal personality disorder. When you go to the cluster B, which we'll look at next week, we have that of antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and then the narcissistic personality disorder. And in the last cluster, we have the avoidant personality disorder, dependent personality disorder, and then obsessive compulsive personality disorder. So these are the various personality disorders that we are going to look at over the period. So now let's look at the first one under the cluster A. And we said in cluster A, the general issues are that their behaviors are kind of odd and eccentric. So what is paranoid personality disorder? So it is marked by intense trust issues. So these people, the basic thing, like just as the English word paranoid. Paranoid means somebody who is suspicious. So suspicion. So paranoid personality disorder is marked by intense trust issues. Individuals with this condition believe others seek to harm them, exploit them, or deceive them. Therefore, they typically avoid confiding in loved ones and may look for hidden threats in social interactions. Individuals who may be experiencing this disorder are always looking out for issues to pick up. They're always suspecting, thinking that somebody is actually hiding something away from them. Somebody is plotting against them, or somebody is trying to deceive them. So always the mind is thinking negative, and the negative is like somebody is not being truthful to them. The other person is trying to exploit them. So the baseline here is they have trust issues. So imagine having a friend, a partner with this personality disorder, there is nothing you do that they will trust. So when we go ahead, we look at how do we relate with people like this? And if you're and somebody going through this, how do you also manage yourself? So through this disorder, they find it difficult to confide in people because they feel their issues are not safe with people. So this person will be going through something and will never share with anyone because they don't trust anybody. Whether you are their loved one or not, they don't really trust you. And when they are in social settings and people are making comments, they read extra meaning and try to find the negative or the threats in whatever is being said in the social settings. Always suspicious. And this can make them so anxious. So somebody who is experiencing paranoid personality disorder would at most times be anxious. And anxiety disorders may also come and be comorbidity to it. So what are some of the symptoms? So like the image on the screen, you are in a room with this person and their senses are almost everywhere in the room. You are pressing your phone and as if they want to see what is on your screen. They are suspecting that you are chatting someone else. Or either you are plotting something against them. So their mind is almost everywhere. And it brings a lot of stress to this individual because the mind cannot rest. So a pervasive distrust and suspiciousness of others, which is the cardinal symptom of somebody with paranoid personality disorder. Pervasive, very strong distrust. They suspect without sufficient basis. Unless something doesn't look like what they're thinking, they just need just something small and they will blow it out of proportion. They magnify it. They will not even have any basis for what they are suspecting, but they'll take it and make it a big situation. And sometimes that others are exploiting them. These are some of the things they suspect without any basis. So you ask them, what shows that this person is trying to exploit you? And they can't give you any concrete response, but they feel that somebody is trying to exploit them. They feel somebody wants to harm them. Or they feel or they suspect that somebody is deceiving them. So even as you are having a discussion with them, they don't trust what they are saying. You are trying to go into an agreement with them and it's like, no, this person is trying to play tricks on me. They find it difficult to even agree. They are preoccupied with unjustified doubts about the loyalty or trustworthiness of others. The doubt are the unjustified. You don't know why they are doubting this person. And they feel people around them are not loyal, so they cannot be trusted. So if you are let's take it, you're in a relationship with somebody who has this disorder, the person is always be suspecting that you are cheating because they doubt your loyalty. They don't trust you. Or it's difficult for them to trust you. If they are subordinate at work, they can't trust any of their things in your care. So if they are not going to be present, it's that you lock the office because they don't trust anybody. No work cannot continue without their presence. Reluctance to confide in others due to unwarranted fears of information being used against them. So as they're having conversations, they are suspecting that, hey, this person, they'll pick something that I'll say and they're going to use it against me. So their conversations are kind of brief. They will not, if they're having conversation with them, it's like they find it difficult to open up. Very, very difficult to open up because of the fear that you end up using their own information against them. So they tend to filter a lot. It's just that they don't trust you. You can be their close whatever. So for them, they don't actually have close friends like that. Not even their loved ones. They are always suspicious. And then, as we mentioned earlier, identifying hidden traits, even behind gentle or non-harmful remarks or events, remarks that shouldn't actually be taken out of proportion, they'll take it differently and be looking for hidden threats in those gentle remarks or comments that are very unharmful. They will look at something to search and identify a harmful remark out of that. Persistently bearing grudges. I have seen the person always doesn't trust.
Well, yeah.
They're always bearing grudges. They are unforgiving of insults. If you insult them, even you may not insult them, that what you are saying, they take it as an insult. Injuries or slights persistently. So almost they have issues with almost everybody around them. If you go to their workplace, problem everywhere. Even if they're in a church, they have issues with almost everything, every procedure in a church, or whether pastors, whoever, they are suspecting them that these people are manipulating things somewhere and towards them. So they may end up even doing a lot of church shopping. They will go to this church today, they still like, they suspect that no, these people, they are up to something. So they'll move, next time they'll not go there again, they'll go to another place. With time, they are suspecting again. So they'll be moved, they'll be on the run, moving from one church to the other because they don't trust. Perceiving attacks on character or reputations, not apparent to others. So they always feel people attacking their personality, or somebody is trying to affect or attack their reputation. So for that matter, they will not try to even give you the chance for you to bring their reputations down. Recurrent suspicions without justification regarding fidelity of spouse or sexual partner. And this is one serious issue. When they are in a relationship, they always feel that their partners, or mostly, I may not say always, that they mostly feel their partners are cheating on them. Without any justification, that's the underlying thing. Without any justification, but they just feel probably how they see their partner dressing nicely lately. To them, it means the person has started going out. Or they call you on phone, you're at work. They call you on phone and the other side is busy. Who are you on call with? You must explain. So almost every now and then you must be explaining yourself if you don't want trouble. And this is what paranoid personality disorder brings. So as the formation that you mentioned, formation of personality and personality disorder, it runs through almost all of them. So some of these points, this point may run through most of the various personality disorders as the causes of it. So talking about paranoid personality disorder, I say genetic factors can play a role. So family history of any mental health disorder like schizophrenia, mood disorders, or any delusional disorders can predispose an individual to developing paranoid personality disorder. So genetically, the person is born with some of those traits. Some biological factors such as brain abnormalities, particularly in the limbic system, or brain injuries or head injuries, in some childhood infections and all those stuff can biologically contribute to formation of some of these disorders. Then, as we mentioned earlier, environmental influences, trauma, childhood trauma, emotional, physical or sexual abuse, and neglect. So, as the child is growing, and like, let's take neglect for instance, nobody seems to care about the person. The child tends to understand that that is how life is. Nobody is there for me. No, so I can't trust anybody. So they start developing this distrust right from childhood. And especially if some trauma issues came up or some emotional abuse. When as a child going through a lot of emotional abuse, nobody is there to give him or her some emotional support. Physical abuse, and the worst of it, sexual abuse. Some of these things go on to affect the person's personality formation. Then psychological and social factors too. So naturally suspicious personality traits, high stress environment, unstable relationships, some of these things can equally contribute to formation of this disorder. So how to be there for somebody with paranoid personality disorder? So if a friend, a partner, a colleague is suffering this disorder, how can you be there for the person? So we said talk without any room for ambiguity. So in communicating with this person, you must be clear and precise so that the person doesn't misquote or take or filter the information. So be straight and communicate clearly with no ambiguities. Prepare them for any triggering situation. So maybe there's something that you want to discuss with them, which is a bit triggering. It's kind of a bit complex. Prepare their minds ahead that this is how what we are going to talk about, this is how it's going to be before you start, so that they will not take things out of proportion. So you prepare them ahead, prepare their minds ahead of what you want to discuss. You must be honest and be firm, but don't dismiss their feelings, because you dismissing their feelings wouldn't change anything, because the person, whatever they are thinking is, or what they are feeling is what they are feeling. So if they say they don't trust what they are saying, well, just let them know that this is the honest thing I'm saying, and this is it. So it's left with you to believe it or not. But you can convince the person, because convincing them will not really yield anything, because the mind is telling them that you are deceiving them. So you just be honest and be truthful to yourself that what you are saying is the truth and nothing but the truth. Do not confront them with their beliefs, because it won't change anything. This is what they believe. They feel their partner is cheating on them, and you want to confront them. Look, they'll argue and try to make it look like what they are saying is true, even without a basis. But they'll try and make strong arguments, and you don't even understand where they are getting those ideas from. Also focus and reassure their strength. So the person, you see, one thing is that people with personality disorders, yes, they have this they have these weaknesses, but there are some positives in them. So the things that they do well, we try to reassure those strengths. So their strengths, we try to champion those strengths. So let's say this person is a partner. Aside being suspicious, they do other good things. Maybe they are very supportive, they are responsible. They do so those aspects that they do well, let us encourage it. But one thing is that you should know that they are suspicious, and that is their weakness. We just manage them like that, but reassure their strength and encourage it. Also, encourage them to follow through with treatment. That's one thing you can help them with. Lead them. But see, sometimes it can be difficult because the individual doesn't know that their way of life is problematic. But I think it depends on how well you communicate it to the person and let the person seek counsel. So an individual, so if you or somebody you know is already experiencing this disorder, or yourself, actually living with paranoid personality disorder can be very tiring, upsetting, and it can feel so lonely. You will feel angry when others do not understand your experience, or embarrassed when you cannot discern paranoid thought from reality. It's like it is you against almost everybody. So you feel alone. It's like nobody seems to be understanding you. You are saying that your partner is cheating, and everybody else is saying that it's not true. But you have the strong feelings that it is true. And it's difficult because you are not able to differentiate paranoia thoughts from reality. So it makes it so distressing. So what you're saying over here, that if you identify yourself in a situation like this, try to educate yourself on what paranoid personality disorder is. Aside this discussion you're having here, there are a lot of literature out there. Read more, ask questions, seek help, and also prioritize building a healthy lifestyle. Try to take care of yourself. Self-care is very necessary. So, and then ask yourself, why is it that you are the only one thinking this way? Why is all my relationships around me, why are they all failing? You should ask some of these questions. Take inventory of yourself and ask. If everybody else is saying this, then you should be interested in knowing or trying to find out if this is really true about me. But where you are fixated on your ideas, like what I'm thinking is that is it. What I'm feeling, that is it. Or what I'm thinking, that is it. Sometimes you may be making mistakes. And you'll be losing a lot of relationships and losing a lot of opportunities as well. Avoid substance use if you find yourself in this category, because substance use will just amplify the problem. It will make things worse off because it's going to affect more brain structures and the situation gets worse. So avoid substance use. Maintain healthy and social support. Set limits around technology and social media use. Where people will go and then go on social media, and especially based on how they feel, they tend to follow things in that way and be thinking the world is like that. So be careful as things that you are scrolling on social media. Now, so that is paranoid personality disorder. Now let's look at the second disorder in the cluster A. So we mentioned that in cluster A, their behaviors are kind of odd and eccentric. And that was manifested in the paranoid personality disorder. So now let's look at the second one, which is schizoid personality disorder. So with this one, it's also a mental health condition marked by consistent pattern of detachment from and general disinterest in social relationships. So these people, they just feel so detached. They are not that they just feel, but they are detached from people. They don't have interest in almost in any relationship, any social relationship. They are just kind of numb, if I should say. They don't have the interest. Not that they don't like you, but they just don't have any interest in being friends or having that interaction. They just don't have. Going to this program, they just don't have. So he said that consistent pattern of detachment.
Yes. Yes, Grandma.
And general disinterest in social relationships. People with schizoid personality disorder also have a limited range of emotions when interacting with others. Their emotions are kind of fixed, fixated. It's limited. That is, it doesn't change like that. If they are unhappy, it's like you don't even know when they're happy, you don't even know when they are not happy. They are just like that. So people with schizoid personality disorder may seem aloof, disengaged, and distant. But the problem is that they often don't realize their behavior is unusual or problematic. So this is a person, someone you call your friend, but the person doesn't seems to be engaging. Even though the person says, I love you back, but you are not seeing anything. If it is like, oh, let's go out, let's go here, they don't have interest in going. You call them on phone, they are not interested in talking. Like, they don't have interest in anything, like any relationship sort of. Let's look at some specific symptoms with the schizoid personalities. So a person with schizoid personality typically does not want or enjoy close relationship. They prefer to be alone. So if you are trying to engage them like that, you would rather be feeling like the person is not in the relationship. So you'll be in that relationship alone. Even though the person is in your room, but you feel so distant away from the person because the person will not come close. Conversation, if you ask them one thing, you can talk before they answer one, and that ends it. It's like, oh, so all these plenty things that I say, is that all you can say? They just don't have interest in those things. You are disturbing them. But we should know that it is not that they have problem with anybody. So you as a partner, not that they have problem with you, that they don't want to have conversations with you. They just don't have interest in those kind of conversations, relationship things. They just don't have interest. So it is not about you as an individual that I have problem with. So we should understand it like this. So if they say they love you, indeed they love you, but how you see those fantasies in relationships and those things, they are not in for it. So you doing that, you're rather stressing them. They feel so stressed up. It's like they feel overwhelmed when you are trying to push them into doing those things. You are working and it's like, oh, let us hold hands. And those things disgust them. They rarely experience or express strong emotions. You don't know when they are sad. You don't know when they are happy. They are just like they are the same person almost every day. Something that has happened that everybody is happy, laughing. It seems aloof, kind of, this thing, why are you laughing? They don't see why you are laughing. It's something that is so emotional that everybody seems to be emotionally disturbed. You not see them change. So whether in good times or in bad times, they are who they are. And you not understand. Has an apparent indifference to praise or criticism by others. Look, you can praise them like what? It is you who decide to praise them. So they kind of maybe say thank you or like they don't fancy that. Maybe you've gone out, you bought something like, oh, my dear, this is so nice. I bought it for you. It's like, hey, don't see anything. And the same way, if you criticize them, they are the same. They don't really care. So whether you criticize them or you praise them, nothing changes. You can insult them, do whatever it is. They are not being listening to you. So that's why I saying that indifference to praise or criticism has little or no desire for sexual activities. Not that they don't want it. So as I said, it's not that it is you who is not attractive to them, but they just don't have the desire for sexual activities. So you can be doing all they will do because probably they are married men and it is their responsibility to do that. So once in a while they may force to do it, but it's not something that they actually fancy doing. And if the person is religious or spiritual type, then that one it becomes another issue. Choose hobbies, activities, and jobs that are solitary in nature. So things that will make them sit at one place, not interact with people. So the jobs or activities that they'll do, they prefer things that will make them just be in their corner. So like playing instruments, you are concentrating on your instrument and you are playing, not interacting with people. Gaming or working on cars, where his concentration is on what he's doing. That's putting this person at a front desk. You disturb the person because they can't relate properly. So your customers may feel like they are not welcome. You put this person at the front desk. So a person like this should be at a place that they are calculating or they are writing some report and they are balancing staffs. They'll do the work perfectly. But situations where they have to show some emotions and stuff, no. So, and they also have that detached and isolated view of life. So life now, they have their own perspective of how life is and how things are, almost out of what the general population is thinking. So this is a schizoid personality person for you. How do you deal with a person with schizoid personality? Respect their space. Because as we said, this person is odd. Their way of life is eccentric, like you don't really understand them. So just respect their space. The same way, communicate clearly, precisely, no ambiguity. Encourage independence, because these people, they are not people that will want to work in groups. Working in groups will disturb them. So these people don't know if it comes to academic work, learning as a group, they don't fancy those things. So they rather want to learn on their own. So group work is out for them. It stresses them a lot when they are to do things in groups. Also be patient with them. As we said, whatever you want them to do, they'll do for you. Whether he responds or not, once they know they're supposed to do this, they'll do it. So just be patient with them and they'll do whatever you ask them to do. And if possible, refer them to seek help, professional help, to see a counselor, to see a psychologist, any mental health professional, and they can be supported or helped. So that is a schizoid. Then the third and the last disorder in the cluster A is the schizotypal personality disorder. We should remember that we say in cluster A, their behaviors are odd and eccentric. So it runs through all the three disorders in there. Schizotypal personality disorder is a mental health condition marked by a consistent pattern of intense discomfort with close relationships and social interactions. Intense discomfort with close relationships and social interactions. People with schizotypal personality disorders may have distorted views of reality, superstitions, and unusual behaviors. So their ways of thinking is mostly distorted, like this, their cognitive distortions. Mostly their views are distorted from reality. And superstitions as when their behaviors are kind of very unusual. People with this condition also have peculiar thoughts and behaviors, like magical thinking. They think they can perform some magic, or they have some magical powers, or like things that they say, you think about it, it's like you don't even understand, or how come that thing can even come to their mind. So they have this magical thinking. Meanwhile, they don't have any of those things that they are saying that they have or they can do. So if you are trying to differentiate the schizotypal from schizoid, a schizoid person is just not interested in relationships or those kind of stuff, but they don't have this magical way of thinking, or they don't have cognitive distortions actually, but they just don't have interest in social relationships. But when it comes to the schizotypal, their ways of thinking is mostly distorted. So usually, sometimes we are not careful. People, because of the cognitive distortions that happen there, some people will think schizotypal is schizophrenia, where there's presence of hallucinations and delusions. A person suffering schizotypal does not actually have hallucinations or delusions. It is just that their way of thinking is distorted. Doesn't follow reality like that. So they are based on how they think, it reflects in their behaviors. So they are saying that schizotypal personality disorder is distinct from schizophrenia because people with schizotypal disorder don't have psychotic symptoms like hallucinations and delusions. Those who were with us in the previous episodes, we've explained all these terminologies. Even though they behave like somebody with schizophrenia, they do not have psychotic symptoms. But their thinking can be so magical. So some specific symptoms: they have intense social anxiety and poor social relationships. Because of their way of thinking, how they think, they are mostly anxious, thinking that something bad will be happening, or people are trying to cause harm towards them. So based on that, relationship with people to become problematic. They don't have close friends or confidants, except from first-degree relatives. So they don't have friends aside their parents or their blood siblings. They don't keep friends because of how they think. They think people don't, like as we mentioned, based on the cognitive distortions. Sometimes they feel so less of themselves. Sometimes they try to read minds of people, jumping to conclusion, overgeneralization, always seeing the worst in situations, that's catastrophizing, and among a lot of distortions. Their behaviors and mannerisms are peculiar. And as we mentioned, they have these odd thoughts and speech. The things that they think are mostly odd, and what they say you will be surprised, like because you like, why is this person saying this thing? And then that magical belief, such as thinking that they have some special powers to do some things, incorrectly interpret ordinary situations or happening as having special meaning for them. Sometimes even they've been watching news or television and they think whatever is happening in the television is about them. That's ideas of reference. They think whatever people are discussing is about them. They can also be paranoid and suspicious of other people's intention. That's where the mind reading is. They think they know what the person is about doing or what the person is thinking. So they become so suspicious. Have difficulty responding appropriately to social cues, such as maintaining eye contact. They have a lack of motivation and underachievement in educational and work settings. So a person with schizotypal personality disorder generally lacks awareness about how their thoughts and behaviors impact other aspects of their lives or other people. They are not aware because they feel whatever they are thinking is normal, whatever they are behaving or how they feel, things they do, they see it to be very justified. Just that their way of thinking is at large out of normalcy. So that is the schizotypal personality for you. So they hold unconventional beliefs or engage in magical thinking, which can lead to conflict and challenges in decision making. Increased anxiety and paranoia. This may lead to mistrust or fear of abandonment, creating tension and insecurity in relationships. And then emotional disconnect, causing difficulty understanding or responding to emotional cues, which can create a sense of distance and frustration. So, as I mentioned, we will just take this three today. So we looked at paranoid personality disorder. We also looked at schizoid, and we looked at schizotypal. But before that, we looked at what personality is and how personalities are formed. So I would like to stop here and interact with you. If there are any contributions, any questions, any concerns, please, we have some few minutes to interact and we are off. So you can raise your hand and unmute and speak. You can put in the chat box if you have any concerns or any questions. Thank you very much for your attention. Please, are there any questions from anyone? Or what have you learned that you can share with us? Any experience that you may want to share with us? We are open to receiving all of them. Okay. There are no questions. And there is none too in the chat box. So I guess you are all okay. Okay, so in the absence of any questions, we'll bring today's discussion to a close. And God willing, next week, we will meet again. And want to remind you that this is this program, an initiative of MasterCard
There's a
Foundation,
question in the chat box.
Springboard Roadshow.
Thank you, sir, for having you.
You are welcome.
No, did you hear me?
You said there's a question in the chat box.
Yes. Yeah.
Linus says, how can a married man deal with a spouse with paranoid personality disorder? So we mentioned some tips how you can deal or handle somebody with paranoid personality disorder. So whether a partner, a work colleague, a friend, all this applies. So we are saying that don't confront them with their beliefs. Just be honest. You know that what they are saying is not true. They didn't do it. Be honest and like tell them that you didn't do it. And don't also make room for them to be suspecting you. Sometimes if your own behavior is making it look like you are doing that, it becomes difficult to manage the situation. So you must make sure that you yourself, you are an honest person. Talk without any room for ambiguity. So communicate with them clearly without ambiguities. Definitely, that spouse have some strengths in her or in him. Encourage those strengths. The suspicions is just one aspect of their life, but they may have a whole lot of good aspects. So the things that they do well, encourage it, appreciate that, and reassure them. And focus on those ones rather than their suspiciousness or their mistrust. And then you are saying that before you have some thought-provoking discussions with them, inform them ahead or prepare their minds that this thing I come to discuss, it may provoke some thoughts in you, but let us discuss it. So prepare their minds ahead of time. Also, encourage them to seek professional treatment. So some of these basic things can help as a married partner if you are able to observe some of these things. But I also want to open up if others want to add on to how marriage couple can handle one of the partners with this disorder. You are free to share your views with us. aside the ones that have been mentioned already.
Hello.
Yes, hello.
I think what you said is in place. There's a saying that no one is perfect. So, as you said, the partner should encourage and appreciate the positive more than the negative. And I think as time goes on, that adjustment will come naturally through that support. Thank you.
Thank you very much. Yes, so we shouldn't always just say because this is how the person is, we are always amplifying their negatives, always causing troubles or arguing with them. They are saying that arguing with this person doesn't solve any problem. So just give them a good reason not to mistrust you. Even before they ask you, try to give your own explanations. Maybe the person called you and you couldn't pick. They start thinking something. So let them know why you couldn't pick the call at the time they called you. Then also set boundaries. You see, it is good to set boundaries. Let the person know that at work, within this time to this time at work, I'll not be able to pick some calls. Or when I'm doing this particular thing, I'm not able to pick some calls. So if you call me and I couldn't pick, don't worry. When I finish with what I'm doing, I'll call you. And true to your words, when you finish with what you are doing, try and call back. When you set these boundaries like this, it also helps you. Give information like maybe you not close from work early. You give information to your partner that today, because of A, B, C, D, I'll be late before coming home. But without any information and you go home late, your partner has all the right to suspect you for passing somewhere. Give her reason that today you'll not be able to eat her food or his food. So clear communication can help you coexist properly with somebody with a situation like this. So just be clear, just be honest, don't hide anything. Be open. But if you want to hide things from this partner, there's always going to be conflict. And as we said, sometimes they don't even have basis for what they are saying. So when they say the thing, don't argue too much. Just say your word should be, I didn't do what you are saying, and that is it. But arguing will just increase the argument or the tension in the house. So some of those basic ways can be helpful. Rosemont says, how do we handle a boy who exhibits schizoid personality disorder? So schizoid, no, we said with the schizoid, the main issue with schizoid is that they really don't have interest in relationship or social relationships. That is with a person who is experiencing the schizoid personality disorder. They seem to be detached. And you're talking about a boy, which means a young or a child who is developing. And we mentioned at the beginning when we were talking about personality that sometimes personalities are shaped right from infancy. So when you are seeing this boy showing some signs like this of not trying to be interactive with the colleagues, you, the parent, have the responsibility to change that behavior by encouraging working in groups, trying to encourage socialization with this child. And not say my child doesn't like interacting with people, so I don't want to do anything. You have the right, if you see it that no, this thing is not right, and this child is young, you have the opportunity to shape it. When we were talking about the formation of personality, we mentioned that upbringing can form a personality. So if right from childhood you are seeing that your child, anytime you go to school, he's always want to be alone. If the friends are coming closer to him, he's trying to push everybody away. Even at home, being in his corner, you don't sit down and just look at that happen. And then sometimes too, the kind of parenting can also influence this. So this is a parent who is always busy. Now, this child, they wake the child up at dawn. I mean, the child will be sleeping and they must wake up, bath, and you are off. Early morning by 6, you drop this child off in school and you are gone. You close late and the child comes. There's no interaction in the house. So this child doesn't know how to interact with people. You've also given the child some rules. Hey, don't play with friends. Don't do this. Don't go out. You gated apartments. You don't go out to do anything. No friend comes to the house. If it is church, you go to church. Instead of allowing the child to go and sit among the Sunday school people and socialize, you keep the child with you at the adult service. It's like you don't want your child to socialize. So sometimes the upbringing can form some of these personality disorders. You didn't allow the child to explore when they were young. So you have the responsibility as a parent to change some of these things. So I'm sure if you're able to follow us through all the 10 personality disorders that will be doing, you realize that upbringing or parental guidance during childhood is very, very important in forming some of these things. So you should be very mindful of how or the parenting style you give to your children. So if your child, you are seeing these things in your child as the question comes, quickly start engaging this child. Encourage the child to work in groups, in teams, attend social functions with this child. And I think it can help the child to change that narrative. You can also see a child psychologist and they can help manage the situations. Thank you very much. But if there are follow-ups or any contribution from someone to please, how can we help a child who is experiencing schizoid personality disorders? Please, is there any other question or any other concern? Elizabeth.
Good evening.
Good evening.
Thank you so much, Sir Jones, for the wonderful presentation. I'm fortunate to be here. However, please, I want to ask, I know you've mentioned that these cluster of personality disorders come with intensity, but how do an ordinary person like me get to tell that this person has shown symptoms or signs for a very long time? And so it could be this, it could be paranoid, it could be schizoid, or what have you. Please, I want you to help me out, because sometimes you can see someone suddenly get detached for a very long time, but how do you, at what point can you now say that, okay, this is becoming too much, and so the suspicion can be that you are under any of these cluster of personality disorder. Thank you.
Thank you very much. Yes, it's consistency actually is necessary before we diagnose somebody of a particular personality disorder. So you don't just take one particular behavior and then say that the person has this disorder, either from a cluster A, B, or C disorder. So persistency is very necessary. You see, but mostly some of these disorders can be shown in how do you call it, the adolescent ages upwards, where like somebody's question came that they are observing this child behavior and how persistent has the behavior been. And then the symptoms that we went through, how many of these symptoms, so at least sometimes you can see that about 4 or 5 of these symptoms should be present over the period of time, sometimes even 6 months, at least 6 months. So it's not about, and that's why a professional should be the one diagnosing. So the symptoms must actually be persistent. And then the behavior too should be out of the expectations, like the norm, the social norm. So there's that deviation from the individual's cultural norm. And then also, the behavior should be evident in at least the person's way of thinking. Because when we're explaining at the beginning, we are talking about rigidity in the person's way of thinking, how they behave, and then how they function. So there should be at least 2 of these things present. The person's way of thinking, the person's interpersonal relationship, if it is problematic over there, then their impulse control or how they behave, these things must also be considered. And especially is their cognition, their way of thinking and behavior. These 2 things are very necessary to be present. And then, as you mentioned, maybe something happened and the person felt detached. This detachment, is it only in that situation or it reflects in other situations too? So the behavior must be persistent in other situations. It's not only just one context. So if this person is detached from people, so in her work, his or her workplace, the behavior is evident over there. His or her social settings, their friendships, their friend circle, and all those stuff, it is evident over there that they are detached from their social settings. In love relationships, this detachment is evident over there. So it should be across different situations and different times. So it shouldn't be just one time that the thing is happening. But in situation A, B, C, D, the person, so it's like, that's why it's persistent. The behavior should be persistent across different situations and times. And then we should also be sure that it is not a different mental health condition that is bringing up itself. So, like for instance, with the schizoid, if you are not careful, you may think the person has depression. So, but what is it that this person previously do get involved in people before suddenly they no longer do this? That's a question you should be interested in. But with the schizoid, it's a persistent thing. So it's not that the person suddenly lost interest in things that they previously do. But if the person used to be very cheerful, playful, and all those stuff, and suddenly they no longer do that, then you should be thinking of a different thing rather than personality disorder. But if it is persistent, then a personality disorder is imminent. Over there, we get to know which one is there. So it should be affecting the person's cognitions, way of thinking, behavior, relationship with others. At least one of these or two of these should be present, and across other situations. So that is how you can tell that this is a personality disorder, especially is the consistency or the persistency of the behavior. That's why we are able to tell that this is a personality disorder or not. But it is necessary a professional comes in to assess, because there are assessment forms that a person will be taken through. There are standardized tests that a person will be taken through for us to come with a diagnosis. So this is the little I'll say about it. And if someone has something to add, please let us add. Okay, so Elizabeth is asking again that, or will you want to speak? Which specialist diagnose this condition? Oh, so any mental health professional can diagnose, a psychiatrist can diagnose, a clinical psychologist can diagnose, a counseling psychologist can diagnose, even a developmental psychologist can diagnose. So anyone in the mental health space can diagnose a personality disorder.
Thank you a lot, sir.
You are most welcome. Please, are there any questions? Okay, so I can see some thank yous in the chat. We are all welcome. All right. No new hands, no new message. Madam Claudia, please, do you have any announcements? But please, those who are not on our platform, you can join the platform, and at the end of the series, we share the slides, and then the recording will also be shared over there. We are sorry the earlier recording or the earlier part of today's discussion broke, but we are happy we are able to reconnect.
Sir,
Yes, hello.
please, this is Elizabeth. I don't know if it's the same page, but I had to join from a team ADHD platform. Is that where I'm supposed to be?
Okay, so the link has been shared in the chat, so you can click on it and it will take you to the platform.
Oh, okay. Grateful.
Okay, so thank you all very much, and I appreciate your presence. All those who asked questions and contributed, thank you. God bless you all for coming. My boss SY, thank you so much for being here. And thank you, Madam Claudia. You are not well, but you've been there for us. Thank you so much. All right, so we'll end today's presentation here. May God be with us all, and we have a fruitful week till we meet again next week. It's a bye. But please, the conversation continues on the platform. So